Hi, my name is Ryback Sizer Longboy. I'm a third year student pharmacist at the Ben and Métis Fish College of Pharmacy at the University of Texas at Tyler. Today I'll be talking to you about the Asmanex Twisthaler and Asmanex HFA Inhaler. The Asmanex inhalers are used for the controlling of asthma. They provide benefits as reducing inflammation in your lungs, controlling asthma symptoms, reducing flare-ups that might need emergency attention, and preventing long-term lung damage. Asmanex is not an asthma rescue inhaler. Talk to your doctor, pharmacist, or other healthcare providers about any allergies that you've had in the past to Asmanex or any other drugs, foods, or substances. Also, talk to them about any drugs that you currently take, including over the counter drugs, supplements such as vitamins and minerals, herbal remedies such as St. John's wort, ginkgo biloba, etc. For the Twisthaler, if you're receiving that specific inhaler, please talk to your healthcare providers about milk allergies, as this inhaler specifically contains milk components. There are differences in the Twisthaler and HFA inhaler. We're going to talk first about the DPI Twisthaler. As you can see on the slide, there are the components of the Twisthaler. The dose counter on the base will read 30 puffs for every time that you first use it. The dose counter will count by 1 every time the cap is removed and that you use the inhaler. The numbers are read from top to bottom. So a 3 on the top and a 0 on the bottom means that there's 30 puffs in the inhaler. To use the Twisthaler, hold the inhaler vertically on the base with one hand. Using the other hand, grip the cap of the inhaler and twist in a counterclockwise direction. Exhale completely to the side, removing all air from your lungs. Do not blow into the inhaler or towards the inhaler. Using the hand gripping the base, bring the inhaler up to your lips horizontally. Then, seal your lips tightly around the mouthpiece, but do not cover the ventilation holes. Take a fast, deep breath. As you're doing so, you may or may not taste, smell, or feel the medication that you're inhaling. That breath you took, hold it for up to 10 seconds, or as long as you're comfortable. Then, exhale. Wipe the mouthpiece dry, then replace the clap by twisting it in a clockwise direction until you hear a clicking sound. That lets you know that it's closed. If you're receiving the HFA inhaler, this slide shows you the components of the HFA inhaler. Some notes on the dose counter. The dose counter will read 120 puffs for the HFA inhaler, but in reality, there's 120 usable puffs, which we'll address in a future section. For the HFA inhaler, when it reads 20 puffs, ask your pharmacist or doctor for a new inhaler, because it is time for a replacement soon if it reads 20 puffs. The dose counter will count down by 1, and do not separate the canister from the actuator. They're specifically designed for Asmanex only. To use the HFA inhaler, remove the protective cap. Hold the inhaler vertically. Shake the inhaler before every puff inhaled. Exhale completely off to the side, removing all air from your lungs. Do not blow into the inhaler. Bring the inhaler up to your lips, still in a vertical position. Then seal your lips tightly around the mouthpiece. At the same time, press down into the inhaler canister one time, completely, and take a slow, deep breath. The breath should last over 3 to 5 seconds. That breath you just took, hold that breath for up to 10 seconds, or as long as you're comfortable, then exhale. If you need to take another puff as directed by your doctor, wait 30 seconds between puffs, then repeat the previous steps. There are some things to consider when storing these medications. For both the HFA inhaler and Twisthaler, store them at room temperature. Do not freeze or refrigerate them. Do not leave them in a hot car. Also, store these in dry environments only. Do not store them where humidity is high, such as your bathroom cabinets. Some special considerations for HFA inhaler users. You must prime the inhaler every time that you get a new one, or for every 5 days that you don't use this inhaler. To prime the inhaler, you have to shake the inhaler, then, with the mouthpiece pointing away from you, depress the canister completely 4 times. You will hear or see four fine mists exit the mouthpiece as you do so, after you complete all 4 of them. Note that the inhaler canister is pressurized, even if it's empty. So do not expose the canister near heat, flame, or attempt to puncture it even when all the medicine has been used, as this could cause the canister to burst. Some special considerations for Twisthaler users. The inhaler is only good for up to 45 days after being opened for the first time from its original packaging. Mark the date on the cap or somewhere which you can remember it easily. Throw away and do not use any Twisthalers past 45 days of opening from original packaging, have a dose counter of 0, or have a cap that is locked up and cannot be opened anymore. Common side effects for both inhalers include headaches, irritated nose and throat, and oral infections. To prevent the onset of oral infections for this medication, it is imperative that you rinse your mouth with water after each use, then spit out the water. Do not swallow the water that you rinsed your mouth with. Some considerations for Twisthalers users. Common side effects for Twisthaler users can also include stomach upset, muscle pain, and back pain. For both inhalers, rare and serious side effects include allergic reactions, such as tightness in the chest, throat, trouble breathing, swelling of the tongue, lips, face, and throat. Some special considerations for HFA inhaler users include signs of an infection, such as fever, chills, mouth sores, and spit that looks unusually colored. Some special considerations for Twisthaler users. A rare serious side effect is menstrual pain. If you miss a dose, regardless of the inhaler that you use, skip the missed dose and take the next dose as scheduled. Do not double up on any doses. That is all. Thank you so much for listening to this presentation. Be well.